So I know there is a lot in store, and we all want to hear from Dr. Ritu. We'll all hear for any questions after that keynote session. Over to you, Srija.
Thank you, Ram. Today, we are thrilled to introduce Dr. Ritu Garg as the keynote speaker for the open house. Dr. Garg is a transformative leader and an accomplished healthcare professional with over 2 decades of experience in the industry. As the Chief Growth and Innovation Officer at Fortis Healthcare, she spearheads strategic initiatives that drive growth in domestic and international markets, enhance patient care, and foster innovation across the organization. A dynamic speaker, Dr. Garg is known for her insightful perspectives on healthcare innovation, strategic growth, and patient-centric care. She's passionate about leveraging technology to enhance healthcare delivery and has a deep love for working with people, fostering collaborative environments that drive success. Her leadership has consistently driven business performance and innovation, making her a key figure in the healthcare industry. Thank you so much for taking our time to address our scholars today, Dr. Garg. I would like to let the audience know that if you have any questions for Dr. Garg, please post it in the Q&A box, and we will answer them soon after her address. Thank you, and over to you, Dr. Garg.
Thank you. Thank you very much, Srija. Thank you, Ram. It's a privilege to be here. Thank you very much for the kind invitation. It's impressive to see the phenomenal work that FFE is doing. It was great to see how the medical students are being supported through their journey. Very impressive, and thank you very much for that. To all the students, I am Ritu. As Srija mentioned a little bit about my journey, but it all started from where you guys are today. Many years ago, I was a first-year medical student, and across the years, I'm an ENT surgeon. I'm from Lady Hardinge Medical College. So gone through that, that anxiety, that rigor, the test results. Ultimately, somewhere on the board, I saw that I have made it. And that was a moment. I'm sure that all of you have felt the same. I think in India, it also, traditionally has been one doctor in the family is also one of the celebrated ways to raise children. And it's always an achievement of not just a child, but for the entire family. So congratulations to all of you who've made it here. It's not easy. And I think over the years, it must have gone a lot more competitive, where I was. I spent 12 years there. So I did my MBBS, then I did my MS ENT. I also went through those areas of uncertainty, what to take, surgical, non-surgical, what to do, how will life pan out? And I can reassure you that it pans out fine. We all find a way. We all find a way to end up where we love, what we like. And what's great about today's world is that it's not that you decide to do one thing today and you can't change. This road is not something that is cast in stone in terms of interest areas, in terms of choosing a specialty. It's a lot more easier to explore the world. It's a lot more easier to explore one's interest. It's a lot more easier to figure it out as you go along. I would love to for all of you to ask more questions while I share some of the thoughts of my own. I think when I reflect back about how medicine and world was when I was studying about 20 years ago, not 20, maybe 25, we have our 25 years jubilee this year. So yes, it's been 25 years for me since my first year of MBBS versus what it is. I think the world has changed phenomenally. Everything has changed. So I am sure since then, your curriculum, the way you are approaching medicine has also changed. But let me tell you what has stayed constant. I think despite everything, the fact that there is a little bit of sanctity to this profession still remains. You would still have many people in the community looking up to the doctors when they need them most, in their most sad, grief areas, and not many professions are like that. So the meaning and the purpose of the profession has remained as is. So, I'm assuming that many of you had that inherent passion. People with only passion can do medicine. I don't think people end up with medicine just for the sake of it. There has to be an inherent passion to drive you to do what it takes to end up. And that passion is valued as much today as it was many, many years ago. But what has changed is the expectations of the society. And as you go along, there are a couple of things I want to share with you about. I am sure all of you know about AI, all of you know about uncertain world, all of you know that there are chat GPTs, etc. of the world. And there are a lot many answers that AI is able to give, right? I mean, today, if you have a complex five question, instead of going to your Hutchison or your anatomical books, you put it up in AI and it will show up the answers. What AI doesn't have today, and the skill that will become most critical by the time you graduate in next 4 or 5 years, depending on which year are you in, is empathy and emotional connect. That is what is going to be missing, and that is what is going to be the most important quality of a doctor as you go along. Because the textbooks knowledge is important that you will get, but frankly, that's not enough today. And you will have tools to help you with that. As you learn all those biochemistry cycles, curve cycle, all of that, I'm sure half of you are wondering, why do I even studying this? But it does give you a little bit of context at the back end, and you will probably not remember it ever again, and that's fine. But over your time in medical school, one thing that I would really urge all of you to do is not look at patients as a case study, not look at patients as a bed number, not say that bed number 2 and 4 has got this, I've got the investigation for bed number 2 and 4. One thing that you all need to inculcate a lot, and I can't stress how important it is empathy and looking and empathizing with each patient as a full human being and connecting with them at that level. And that is the skill that technology cannot have. That is the skill that technology will not replace. It will aid you in everything else except this emotional quotient. Extremely important. And as you go along, that will become very, very, very critical. The second thing is that today, especially in India also, we are in a world of super specialization, right? You guys will do your graduation, then many of you will end up doing post graduation, super specialization. So as you continue to grow and grow deeper, we tend to just look at a person as a part, right? So let's say if you become a cardiologist, or if you or anybody else, right? There is a tendency to just care only about that organ or about a disease pertaining to that system, and then saying that for the others, go to XYZ. Now, that has got pros and cons. It gives the depth of the specialization. But again, sometimes we lose the context of the overall picture. And that's another thing that I would urge you all to keep in mind as you go through your life and as you start thinking about it, that it's very important. It's good to have super specializations, but always keep the context of the overall human body and reaction prevalent. So just because, it is not a cardio problem does not mean that, you don't provide them answers. While you can get a specialist to opine on them, but ultimately a patient is our responsibility till the end. And if we don't have the answer, and it's all right, because in medicine you will realize that while patients sometimes and the families would expect you to have all the answers, you won't have it. Because we all study medicine is very algorithm driven, right? I mean, we all go to our textbooks. Our textbooks tell us that this is what you're supposed to do for any specific condition. And then, yes, there's a lot of research that happens, and we keep updating that. So let's say there was a research, there was an algorithm which said that in fever, you're supposed to do these 5 tests. Over years, people keep researching and they say, oh, guess what? There's a 6th test which is available. And then that gets added. Then somebody else says, oh, there's a research and we've done like, 1,000 patients, and, we tend to miss this. So it's an evolving branch. And we need to continually keep updated our knowledge and applying that. But the immediate point that I'm trying to say is that keep that in mind, that when you are in a class of cardiology, don't forget gastro and others as well, because it's all interconnected. So it's not enough to say that, look, it seems all right, the heart seems all right. Well, if it seems all right and patient is not well, patient is not well. That means it's our job to help find the answers, which are even beyond our expertise. So holistic approach is very, very, very critical in the changing times, in uncertain times. I would also like to talk to you about a little bit of other things that have become important, which may or may not be part of your curriculum. Besides empathy, which is, not formally taught, but a very important point. I think as you go along, by the time you guys graduate, there will be a lot more data that you will all have to deal with. In our times, it was all paper and pen, right? I mean, we would go as interns, we had files. Anybody could walk into the wards, get access to the patient files, do whatever they want. Nobody, we were never even aware of data privacy rights. We were not aware that patients' data is important. In many medical colleges, you would have patients' name written all over, files being all over. Well, that has changed. And that is going to change faster than we think. I mean, it's changing as we speak right now. Patient owns that data. And as clinicians, then it becomes our responsibility to ensure that patient's data is secure with us, because patient has entrusted their most personal, deepest, family history as well as other personal history with us, and then we become custodians. Think of it like a bank, right? So we have got our financials with the banks. Now we expect them, anybody and everybody in the bank, to protect that confidential information. Similarly, a person's health history is extremely confidential, right? We are very particular about who we want to share this with, who we do not want to share this with. And these are some of the concepts. I'm not sure if they've already started addressing those in the medical curriculum. But when you're going to step out in the real world after graduation, then these things will become relevant, because you can no longer say that, this is the patient's history, and send them on, let's say, a WhatsApp or to anywhere else. Or, there are laws, data protection, privacy is becoming a very big thing. So you'll have to start realizing that and making sure that you're a little sensitive to that. The third thing will be, again, I don't know how many medical colleges today have electronic medical records. That's another thing that's a given. By the time you guys graduate and get into your practices, after your residency, etc., your electronic medical records would have become a very significant part. I mean, there will be no choice. Now, that has 2-3 meanings, right? Which means that you'll have to become digital savvy, because you'll be expected to write patient notes on a system, and that is going to be universal in next few years. And also, which means that means that now all of it is time stamped, and medical legally you become a lot more liable. It's got good and bad, because if you've done the right thing, then, and if you've documented it, then it's for your own good, because now you know that, look, I had seen the patient, this was my impression, I have noted it, I have written it. But if you're miswriting it, if you're not documenting it properly, then that will become an issue. So again, as you practice, make sure that you get into the habit of writing your history, your intervention, your impressions properly. And ultimately, you will all have to put this and get into practice of doing electronic medical records. There will be their past history. You're supposed to look at that. So all of those skills are going to be a lot more relevant today than they were many years ago. And especially by the time you graduate, all these things will become very, very critical. Besides that, there will be life has its way to teach us and get us back on track. So if you feel a little overwhelmed, please don't worry. I remember when I took my first anatomy stage, and many of us were doing very well in school to have ended up where we did, right? So we assume that it'll be a cakewalk and that we are used to cracking exams. And here comes the anatomy viva and anatomy stage. I'm like, oh my God. And I see in the list that, oh, I'm somewhere down in the list. And I got a pretty strong spanking from my anatomy professor as well during the stage, right? So all of us have gone through that. Those are the moments you feel, where have you landed? It can become overwhelming. Medicine, even today, can be overwhelming. There is no denying the number of hours that one puts in medicine is unparalleled, and it will continue to do so. The unpredictability of life, doing late night surgeries, getting up at nights, coming for emergency calls. All this is a way of life, which many few people can understand at how difficult sometimes it is. It's this and probably the armed forces are two professions which are very difficult for anyone else to comprehend, because you'll be sitting in a movie with a family, and then you'll have to rush, you'll have to leave and rush because your patient needs you at night for maybe a surgery that happened last year, last night or this morning, right? So all that walk of life would happen, but I think if you're passionate, if you are just ethical, passionate, and doing the right thing, I would say it is still one of great professions to be in. It is probably one of the very few professions where the level of satisfaction is huge, because even today, patients will come with so much gratitude. They would write books of how their lives got saved and how grateful they are. I know of families who name their children on the doctors because of the impact that they've had. And again, that is also a very unique thing, right? So there's a lot of meaning in this profession. There is also an immense need, which is there today, which will always remain, irrespective of any kind of technological disruption, because humane element cannot be taken away. In fact, it will become more and more relevant. And that is why the skills are no longer about a rote learning. It is about human connection for medical professionals more than ever. So those, I see a lot of questions in Q&A. So Tanvi, do we open it up or?
Yeah, I think the Q&A box is overflowing with questions, Dr. Ritu. I think most of them, we can start with the basic ones where, a lot of questions are being asked on, how to handle the academic stress of the course itself. I think a lot of first year, second year students especially go through that stress a lot. So we can maybe start with that and then.
Yes. Yeah, look, there is no easy answer, because in the end, you've got 5.5 years. And while it may look very relevant today, a lot of these, complex cycles, why do I need to see? Why do I need to know all kinds of bacteria beneath the microscope? Why do I need to understand all that microbiology, etc.? But it's important. At some point, it is important. It may not look that important today. So my view, try and understand the concepts, because once you understand the concepts, everything else is a little easier instead of a rote learning. I would say that, try and do group studies, because you always have different skill sets, and, somebody is usually stronger in one subject, another is stronger in another subject. So if you have a group of friends who study together, it becomes very, important, and it can help you do that. And most importantly, when your body tells you that you're exhausted, you are exhausted. So don't try and punish. And if you need rest, you need rest. So it's okay to break it up and take your moments of recovery. That will be important. And I would say that sometimes it becomes overwhelming because the discipline of small everyday learning is lost. So let's say if you've not done what requires to be done weekly or daily, and then you end up with 3 months of syllabus together for an exam, that's when it becomes overwhelming. So my suggestion is, again, and I call it, this power of compounding, which means that do not lose the rhythm and discipline of doing a little bit every day instead of doing this much at the end of the week, because that's when it becomes tiring and difficult to do. If you're going to do this much every day and show up for your classes, even if it's okay to bunk once in a while, by the way, it's all right. So do that as well, because this is also the time which is not going to come back. This is also the time to forge friendships. It's also the time to have debates with your friends and, discover yourself as a person. All of that is, it's such a great time. I'm feeling so nostalgic even thinking about what it was back then. So do all of that, but somewhere just maintain that consistency. And once you maintain that consistency, it will be okay. And once, if you've reached here, that means you've already done part of it earlier. So it's not tougher than that. And I don't know of people who have got in and have not got out. So eventually you will. The failure rate is fraction of what it is versus cracking NEET. So if you've done that, you'll do this.
Thank you,
Dr. Ritu. Dr. Ritu, I think one of the other things which a lot of scholars go through is, while they're still going for their day-to-day studies, constantly they're also thinking about the next move in their careers or how to prepare for PG. And I think that's one of the most asked questions in the Q&A as well. When should I start preparing for PG? How should I do it? How should I balance my current classes with the PG preparations? Do you have any tips for the scholars?
Yeah, so PG preparation is critical. But again, when you go for a PG preparation, the questions are actually based on what you're reading today. Because human ultimately, so depending on, which exam are you kind of applying for, in the end, it is all medicine, right? And medicine has its components of your current curriculum. So my view is that if you go deep and study carefully about, your own classes and you understand the concepts, then it's about the format which is different for PG exam, right? I mean, I did my MLE, cleared that, I did my NEET, etc., all together at that time, and drawing just a parallel, right? So I was preparing for my PG exam here from Lady Hardinge Delhi University, and so I didn't apply. I was not preparing for MLE at all at that time, and I just was preparing for my PG exam during my internship. So I cracked that. And just after that, I gave MLE, frankly, I took MLE, but without any specific preparation. And it was fine because ultimately it's just the format that changes, the knowledge doesn't. So if you are good and if you're focusing on your studies, your regular classes, it won't be that difficult. Yes, you will need to do a practice, etc. So my view is, and again, I don't know, probably the world has changed from my time, but my sense is that at least first 2-3 years, don't bother about it. You just work on your current, and probably towards the end, your final and then internship is when you could start preparing. Also, when your clinical rotation starts, just pay attention to patients. Yeah, I mean, there is no learning which is more than your practical learning inside the hospital. When you're interacting with the patients and you're doing your case studies, I think that is where a lot of learning is there. If you actually do those cases very well and look at those patients well, there'll be a lot of learning that is going to help you in your PG exam.
Thanks, Dr. Ritu. Srija, I think you have a few more questions noted.
Yeah, there are many more questions. I'll just take one. The caller is asking, I just wanted to ask, how can we continuously evolve our knowledge in medicine apart from the textbooks we study, and what are the fields and opportunities we can pursue in India as well as abroad after completing our MBBS?
So in terms of knowledge, I think you will have to continuously read what is getting churned out. So there are multiple journals. If you're interested, there are also multiple, places like a PubMed, etc., where new researches keep on coming. And I know that I'm sure there must be some other sites also. I think that is very, very important to be abreast of what's happening. So another thing that I missed talking about is genomics, and I don't know how much of it is there in medical curriculum today. I would urge everyone to really try. If it's not in the curriculum, please try find time and read about genomics. By the time you guys graduate, genomics would have become a standard of treatment and care in many places. It's already starting to in next 4 or 5 years. Pretty much it would change medicine drastically. And when you start reading about these things in newspapers, just keeping your general knowledge alive in medical community through different forums is going to be very important. And that's how you'll keep abreast. It's not reading scientific journal per se only. It's also about, there's a lot that gets published generally through newspapers, through medical journals, and so on. So just continue to read that. In terms of the options, there are many. So let's say, after graduation, you think that you do not want to go the clinical practice route. There are many which are available. People can do hospital management, people can do MBAs, like I did my MBA in finance a lot later. But there are people who can do, such things also. So there are options in medtech industry, there are options in pharma industry, there are options. So today, I think the options are not an issue for medical graduates here.
Thank you, Dr. Ritu. So there's one which is slightly related. Scholar is asking, is saturation in the medical field a matter of concern for medical students? Which specialization will boom in the field of AI generation?
So, look, I mean, there is going to be a little bit of a saturation, and I think that is why I'm saying that, while there'll be a lot of people, I'm not sure will there be a lot of good people, good doctors, and I think the focus should be on ensuring that I'm not a person with just a degree, but how do you give value to that degree will become very important, and that will always be in shortage. That is always in shortage, despite increasing number of medical seats, despite increasing number of medical colleges, etc. We still have a significant shortage of well skilled doctors with human touch. So if you do these two things, I can guarantee you that you will not have dearth of options. Just learn to be with patients properly. I think that is the skill which has somehow gone missing over the years, and that is one which is much, much, much needed.
Right. Another one is how to get more clinical knowledge during posting, because I am in the 5th sem now, but still don't have confidence to take history and examination of patient.
Start taking them, you will feel more confident. This is a chicken and egg story. So when you talk to a patient, don't think that you're taking a history and that you have to ask 10 things. No, you just have to sit with the patient and just listen to them for 15 minutes, process that for 15 minutes, write that down, and just start thinking logically. Just do a deep conversation with patients. And I can tell you, some of these patients who are chronic, who have been through any of the disease, like a heart patient, a diabetes patient, so on, they know so much about the disease which is not written in the books, because they are the ones who are experiencing it. Patients can be your biggest teacher. They will tell you that, if we care to listen carefully, they will tell you how the disease progresses, what was it, what were the symptoms before, what are they not before. So if you just sit down and just deeply listen to them, your history taking will be, and don't go as if, just approach them as a friend. Sit down, approach them as a friend, as a family. The amount of learning will be immense.
Thank you for that.
Dr. Ritu, I know you have a constraint of time, but there's a few more questions that maybe
Yeah,
two more
please.
that we can take if you have time.
Yeah,
So
sure.
another question that students are asking is that everybody, including our professors, and now you are also talking about, empathy as one of the most important skills to become a medical professional. Why this is so stressed upon these days, and what are your tips on how we can build this from an early stage?
Yeah, why it is being so stressed is because unfortunately, a lot of these interactions have become transactional. Because volume of patients are so much, and sometimes people just sit in their cabins. Doctors, they're all well-meaning people, but it has not been ingrained into them. And then somebody will come and you start looking at them as a case, not as a person. So they'll come, you'll say खांसी है, जुकाम है, फीवर है, ये तो मेडिसिन लिखा, अच्छा आप चाहिए, अब 2 दिन में आइए, अरे आपका तो ठीक लग रहा है, अभी तो सब ठीक है, एक्सरे तो ठीक है, आप तो ठीक है. But guess what? The patient is not feeling all right. The patient is saying कि आपको एक्सरे ठीक लग रहा है, लेकिन मैं ठीक नहीं हूँ. And then we become impatient and say मुझे नहीं पता, एक्सरे तो ठीक लग रहा है, अब आपके दिमाग में ही प्रॉब्लम होगा. That is what is not acceptable today. Because you have to believe that what patient is saying is right, and that if I'm not able to get an answer on the x-ray, then I have to think harder as to what's bothering. And that is why it is being talked about so often. Unfortunately, over time, you would hear a lot that community also starts talking about commercialization, right? They start thinking that, oh, doctors have become very commercialized, they only want money, they don't spend time enough, right? In some of the developed nations, for example, it's mandate that doctors are supposed to spend 25-30 minutes with the patients. That's not the norm in India, right? And then also in India, sometimes you're talking to a patient, the doors are open, somebody else will come in, there'll be multitasking. I'm talking to a patient, but I'm also taking a phone. Now when you're in a patient's shoes, you don't feel respected, you don't feel that there is a connect, and that's why it seems transactional. And that is why you lose the meaning of it, you lose respect. That is why doctors feel, patients start to feel that, oh, you know what, the guy comes, he writes 2 rupee, 2 line likha, and then he's asking for $1,000. That's when you lose trust. And that is why we feel, and I run a healthcare chain now, so I see that all the time, and that is why empathy becomes so important. So that the human connect is there, you respect that person, you listen to them, give them time, you're not in a hurry, you respect their privacy. So all these things important. How to inculcate? Just when you go to a bed, don't start saying bed number 3, 4, just say who the person is, just start looking them as people, talking to them as people. You will inculcate this by the time you graduate.
Thank you, Dr. Ritu. One last question, Doctor. A student has asked, do you have any regrets in your medical journey, or you would have done something differently? I would rather ask you how you have done so many other different things, but I think we'll need a whole new session for you to address that question and some other time. But is there any last thoughts that you'd like to share with our scholars today?
Well, actually, no regrets. I think I loved every bit of it. When I was young, I always wanted to be a doctor. So it was, it went well for me. It was all good. Going back, what I could have done more, maybe the advice that I'm giving you, frankly, maybe I could have been a little bit more empathetic. Maybe I could have spent a little bit more time with patients. I think going back, that's the advice I would give. Maybe I would have made little stronger connections, deeper connections. I think that's what maybe I would have done differently.
Thank you so much, Dr.
Thank you,
Ritu.
Dr.
Thank
Ritu.
you
It
for your
was
time.
such a masterclass. With various different things which you touched upon were very, very profound, and right from how this entire profession is so important. And you rightly said, I think if at all any profession comes closer to this one, is probably the armed forces. I don't think I would have thought I would make it to the session today. I was down 2 days back with viral, and thanks to the doctors, and I'm here and able to talk. And then there was one thing which was written behind when I was visiting the doctor, said, I want to treat you the way I want to be treated. And that was exactly what you were talking about, and that makes a huge difference. I think with the technology evolving, that will only help us to fast track certain things. But I think the human element and then the profession, the the dignity which happens and the respect which is there is going to be there. And it's been a phenomenal session. I think we're going to sign you up for a few more sessions like this because there's a lot to be covered. And I see a lot of Q&A coming in from students. But I know you are a busy person, Dr. Ritu Garg, and taking your time for actually spending and sharing your knowledge with the students has been immense. Thank you.
Thank you. It's been a pleasure. Thank you so much. And wishing you all the very best in your journey. I'm sure all of you will do great. You'll all make your country proud. So it's a great profession, and wishing everyone all the best. And thank you, FFE team, for organizing. It was such a pleasure. So thank you.
Thank you once again, Dr. Garg, for your time this morning. It is an honor to have you. Have a great day ahead.
Thank you. Thank you.
Today,